Good morning, everybody. It gives me immense pleasure in welcoming our panelists and all those who have joined this edition of the Hindu's Wellness Series, presented by the Chennai-based Rajan Dental Hospital. Today, we are going to learn all about full mouth rehabilitation, the topic that our distinguished panelists will give their inputs on during the next 1 hour is teeth forever with full mouth implants. We all understand the importance of a pretty smile and a good set of teeth, and are probably aware that lifestyle choices have a profound effect on our oral health. When we are faced with a bad dental condition, and lose teeth due to old age or gum diseases, dentures are perhaps an option. When all the teeth are lost by, as the doctors say, by the age of 60 or 70 years, people generally wear complete dentures in their upper and lower jaws. But imagine wearing a complete denture when you're in your 20s or 30s or 40s. It can be a major psychological blow. And there can be situations where one loses permanent teeth at a young age, could be due to accidents, due to ill health, or some syndromes. And that is when the titanium implants are embedded in the jawbone. This gives the patient a feeling of having their natural teeth, which is firmly fixed in the jawbone. And when people suffer some severe mutilation of their upper jawbones, then special implants called the Zygoma implants are used in restoring their facial appearance, sometimes speech, and also chewing ability. To talk more about full mouth implantology, we have with us today Dr. Gunasilan Rajan. He is the maxillofacial surgeon and medical director of Chennai-based Rajan Dental Institute, the president-elect of Asian Association of Oral and Maxillofacial Surgeons. Dr. Gunasilan is the chief mentor of the Implant Master Program at Rajan Dental Institute that pioneered implantology 2 decades ago. A recipient of the Tamil Nadu Government Scientist Award for Medicine in 2002, and the founder of Chennai Dental Research Foundation, Dr. Gunasilan has held several prestigious positions in various dental associations, published nearly 50 papers in national and international peer-reviewed journals, and delivered several orations. A very warm welcome to you, Dr. Gunasilan.
Thank you.
Our other panelist today morning is Dr. Sunil Kumar Netamo, Professor and Head of the Department of Periodontics at Melaka Manipal Medical College in Malaysia. Besides attending several international conferences, presenting and publishing papers, teaching and training medical students, Dr. Sunil Kumar's contribution as consultant for periodontal problems are noteworthy. He specializes in zygomatic implant placement and the use of flapless implant placement techniques to preserve the interdental tissues to the maximum. He's known for using lasers for treatment of various hard and soft tissue lesions and infected periodontal sites in the oral cavity, and has performed various periodontal plastic surgical therapies to achieve a proper smile line and meet the aesthetic demands of the patients. A very warm welcome to you, Dr. Sunil.
Thank you.
We also have participating in this webinar, Dr. Gauri Nataraja Rathinam, consultant prosthodontist from Rajan Dental Hospital. a Bachelor of Dental Surgery from Tamil Nadu, MGR Medical University, Chennai, and a Master's in Dentistry and Fellowship in Dental Implantology from the University of Alabama, Dr. Gauri has more than a decade's clinical experience in implantology. She has worked extensively on full mouth rehabilitation patients, has been a faculty in various implantology courses and fellowship programs. She has also been involved in many clinical trials. A member of the Indian and the American Dental Association, she has 10 research publications to her credit. Welcome, Dr. Gauri.
Thank you. Thank you very much.
I would also like to request all the attendees of this session to listen to our three doctors with patience and post their questions once the Q&A box is open for you. And you may also direct your questions to the specific panelist if you wish to. I would be happy to squeeze in as many of your questions at the given time. To start with, I will now hand over the floor to Dr. Gunaseelan, who will give us a presentation on full mouth implantology before we move forward with the discussion. So over to you, Dr. Gunaseelan.
Thank you, Soma. Let me get started right away. I bring greetings to you from Rajan Dental Institute. We are a premier dental hospital in Chennai, founded more than 60 years ago by my father, late Dr. Professor B.P. Rajan. So over the years, I've taken the lead in implant dentistry, and we have been pioneers in implantology in India, especially in full mouth implantology. We have done guided surgeries, Zygoma full arch implants, and Nobel guided teeth in 1 hour concept as the first in the country over the last 20 years. So we have all our dental specialties under one roof, because as you know, today dentistry has several subspecialties such as oral and maxillofacial surgery, prosthodontics, periodontics, oral medicine, orthodontics, etc. So we have all specialists under one roof. We have our own operation theater in case patients need sedation or general anesthesia. We have our own ceramic dental lab and also specialized CT scans called the cone beam CT. Unlike a medical CT, this has much lesser radiation for the patient. So we are today also recognized by the International Congress of Oral Implantologists. This is the biggest dental implant organization in the world, and we are one of the very few recognized dental centers in India. I'm going to straight away start about looking at some medical issues for patients, because before we straight away go into implants, it's nice to know about the medical history and how it can impact the dental health, oral health, and also prognosis as far as implants are concerned. We know that a lot of patients are diabetic. So it's essential that we record or check their fasting glucose. And then we also look at the long-term control, which is called the HbA1c. The HbA1c, if it's less than 8, we consider this as good glucose control. If it's 8.1 to 10, it is moderate, and above 10, it is poor control. So how can this impact implants? If you have good control of diabetes, implants are very predictable for long term. However, if you have poor control of diabetes, it can lead to poor bone integration and higher failure rate. So it's very important for diabetic patients to make sure that the diabetes, the long-term control is known before we embark on implants. Because if not, you can land up with infection like we see in such a patient, and that has to be corrected. A lot of patients, as they get older, also get into some form of cardiac issues, blood pressure, ischemic heart disease. They may have undergone CABG, this coronary artery bypass graft. If they had a bypass graft, if they had a cardiac stent, they invariably put on medications such as blood thinners. You know, most of these patients are on blood thinners like aspirin, piclopidin, clopidogrel, Plavix, and combinations. And then some of them are also on directly acting anticoagulants. So this will impact our treatment. What about bone disorders? As you get older, again, one of the common things that you're recognizing is what's called osteopenia and osteoporosis. When bone is less, you need to do a special scan called the DEXA scan or a bone density scan. So that will also determine on how we treat these patients. Patients with osteoporosis are also put on what called bisphosphonates, Fosamax, Zometa, some other trade names, and some monoclonal antibodies. This will also have an impact on how we approach the patient from long-term treatment. Many patients take thyroxine, thyroid supplements, so this can also have a role. The reason why I'm mentioning all this is we should look at the medical history, the medical health of the patient before we go on to doing any form of dental implant treatment. We talked about full arch, full mouth implants. So why do we need it? So you see patients like this with so-called teeth, but they're only roots. They can't chew with this, they can't smile with this. And you can see this is what we call as a mutilated dentition. In my terms, it is they are dental cripples. They are handicapped because they can't eat well, they can't speak well, they have a huge issue psychologically when they walk around with teeth like this. And then you have conditions, what we call as a grade C periodontitis or severe gum disease, where the patients have lost a lot of their gum, and so the teeth become very loose or mobile. And this is even in younger patients. In this X-ray, you can see there is a lot of bone that is lost. You see the white line should have been a horizontal line like that across, but it's all gone down and is wavy. That means there is severe bone loss. And once a bone is lost, then the teeth become very shaky. And then we need to remove these teeth. You cannot save any of these teeth, even with very advanced gum treatment or surgery. So what do we do in such patients? We take out all the teeth, we put implants. These are what's called straight implants. We put 6 to 8 implants in each jaw and then put an artificial tooth. But then comes a condition where you do not have enough teeth, enough bone in your jaw. See, when you lose teeth, you also lose the bone in the jaw. And then you're left with very little bone. In such instances, we need to put some artificial bone. We need to graft bone. We take sometimes bone from other parts of the jaw bone, like the lower jaw, or sometimes from the hip bone, and we transplant that bone into the jaw bone. You wait for some time and then you do implants. You wait another 6 months and then do teeth on top of the implant. So it's a long process. To overcome this, Professor Brennemark from Sweden introduced a technique called Zygoma implant. So what he did was, if this is your jaw bone and there is no bone here, and this is your sinus, he said, let's use the next bone. This is your cheekbone. That's technically called the Zygoma bone. And he put slightly longer implant and anchored it there, and then put some smaller implants in the front and then put teeth on them. So this is called a full mouth upper jaw rehabilitation using Zygoma implants. The huge advantage here is you're not using any graft. There is no graft, which means this treatment can get over literally in 2 to 3 days' time. So that's a huge advantage and a huge advance that's happened over in the last decade. And we have pioneered this in India, and this has helped a lot of patients. So here you see an X-ray where there are 2 long Zygoma implants and 2 small anterior implants. And we just need 4 implants to replace all the jaw teeth, and the lower jaw also 4 implants, and we replace all that with the denture. So we now have less implants, no bone graft, and very quickly we can give them teeth. So this is a huge advantage of present day implant dentistry. And you can see the patient. I'm just going to quickly run through some preoperative and postoperative pictures where you can see the transformation for patients. We started with older patients, 60s, in the 70s and the late 60s, 50 years of age. Again, you can see how the no teeth to teeth within a matter of days, completely mutilated or gum disease, which has affected these teeth, and then you transfer them into a healthy and a pretty smile. Here again, patient wearing a complete denture at the age of 58, and then we could do fixed teeth. Again, you can see the transformation in the patient's profile. And slowly we started noticing that we were getting younger and younger patients. who needed these teeth. Now, look at this girl who had, again, mutilated dentition. We had to remove all the teeth were mobile. If she was talking, the teeth were moving. So we had to remove these teeth, put her on fixed implants and artificial teeth. And then what we saw was syndromic patients at a much, much younger age. So this is a syndrome where they don't form the jawbone at all. They don't have teeth from the beginning. There are very few milk teeth, very few permanent teeth, and hence a jawbone does not form at all. So in such patients, we have to either do big, heavy-duty bone grafting, or you use the Zygoma implants and then do no grafting and then give her artificial teeth. And as you can see, more and more pictures of younger and younger patients. And you'll be surprised, more than 80% of our patients are less than 45 years of age today. So that makes a huge difference in what you can do for such patients and transform them virtually overnight. So I've just run through some pictures to show you what can be done and what is technology doing to help us. Today, we have excellent software. We have very nice programs. We have virtual surgeries that we can plan on the screen. So this is one such patient where we have planned 4 Zygoma implants. So you can see that this is the jawbone virtual model. So this is the cheekbone or the zygomatic bone. So we have put 2 implants virtually on either side. And this is a stent, which is made of a plastic-like material, a PEEK material. So what it does is, it takes a lot of guessing out of the surgeon. So you can place this, you can place artificial teeth on top of it. So virtually, you've done a virtual surgery on these patients. Then you transform it into a guide, a surgical guide, which means the surgery becomes very precise and much faster and very, very predictable. So this technology of using a surgical guide has become very common. And then when you do that, you can see on the left side, there's a patient with virtually no teeth in the jaws. And then on the right side, you can see how we have put 4 Zygoma implants and lower jaw also 4 implants, and we restore them, their smile fully. And then one of our biggest surprises was when he had a 5-year-old boy with a syndrome and no jawbone. So he was wearing dentures for almost from the age of 4. And when he came to us because his lower jaw dentures were not staying in place at all. So he was refusing to go to school. The upper jaw denture was fairly okay, but the lower denture, because of the tongue encroachment, the tongue was pushing it away. He could never keep it on while eating or talking. So we had to do 2 implants for his lower jaw. You can see on the right side, we got 2 implants and then fix the denture on it. So this is this was the youngest patient in Asia at that time when we did this about 3 years ago. And worldwide, we have only about 10 patients less than 5 years of age who have had implants. But what we are seeing over the years is more and more younger patients who need the benefit of this treatment. And then with technology backing us, we're able to give them this sort of a service. I'd like to close now with this brief introduction. So we have a sort of stage set of what we mean by full mouth implants and what we mean by these advanced techniques. And then we are very happy. And this is a complete teamwork of several dental specialists coming together and treating this patient. So I'm happy to give it back to Soma to take it forward. Thank you.
Thank you so much, Dr. Gunasilan. That was a very, very informative slide presentation, though with scary pictures, but all the smiling photographs, they really make you feel better at the end of the slide presentation. So let me just start with one very, very basic thing. Like, at what stage of degenerating oral hygiene or oral condition do you take a call that this patient has to go for total mouth implantology, or you leave it to the patient? It's the patient's choice. You give them options. I mean, how do you decide that whether we give dentures or we do full total mouth rehab?
Sure. Very good question. I'll let Dr. Sunil answer
Sure.
that, please.
Sure.
Actually, if you look at the patient that who is doesn't have, much teeth, and maybe 4 or 5 or 6 teeth are left in their mouth, and their oral conditions, maintenance wise, they are maintaining well due to some other reasons. They lost the tooth. So those kind of patients, we surely go for the, full mouth rehab. So we explain them how to place the implant and what need to be done for those kind of cases. Another area, what you said that, actually because of habits, they are losing teeth. One, and the second thing is their maintenance is very bad, and they're not able to. They're not brushing daily, morning and evening. And once, I seen patients once in a month they'll take the brush. So these kind of patients, if we are going with the implants, actually it doesn't make any advantage for them. The reason is implants means it mimics the natural tooth. So how we have to maintain our natural teeth? The same way, if we are able to maintain implants, it will be there forever. The maintenance is not good, and habits, if they are not changing, and habits in the sense, for example, smoking, gutka chewing, and automatically there won't be any blood supply that area because of the habits, and survival of the implant will be question mark. So those kind of a patients, we always say that better not to go for implant. There is no advantage for the patient. So end of the day, being a doctor, we look at what best we can give to our patient. So for 1 year, 6 months of giving the advantage, and we don't want to go for such a good treatment protocol to those patients, and it's an unnecessary time waste and money waste of everything to the. We are looking at the patient aspect. So we generally explain to the patient in detail that, okay, your bone quality is this, and you need to stop your habits, and then you have to maintain like this. So all these parameters, if you are okay, then I need to see you for some time. So first, whatever the existing teeth, we'll try to maintain, and then give some removable dentures for some time, maybe 3 to 6 months like that. And we are very happy that patient is, back to maintain very good. And he really want the teeth. Then we'll go for a full mouth rehabilitation that with implants. It really helps to the patient.
So when you actually talk about full mouth implantology, does it mean that if the person already has a few good teeth, so those remain, and you kind of change or implant new ones where the situation is bad, or it is the whole thing? Like when people go for wearing wigs, even if you have little hair, they will first shave off your crown and then they'll put the wig. So is it something similar, or is it like you can do it partially, but you call it total mouth?
Prof, you want to take this question?
Gauri?
Yeah, I can add a little on that, sir.
Yeah.
To answer your question, if you have some few good teeth, we always try to retain the teeth that we can. But again, as doctors, we need to make sure on a long term how that is going to help. If we know that that teeth is not going to help us in a long run, say for instance, if it does look good now, but in another few months, if that teeth is going to give them trouble, it is our responsibility to tell them. Again, that psychological preparedness, all that has to be put in that patient. Like you saw in the presentation, there'll be 10 to 12 teeth in the mouth, but nothing is going to be of big use when we are replacing them. So when we are putting implants and putting teeth, the existing teeth, we would try to retain as much as we can, but that retained teeth should not impair the function of the teeth that we are going to give. So we look at a holistic approach. And if the teeth demands removal and replacement with implants, we do suggest them. If it is going to help us in the rehabilitation, we retain them. So that is how it goes.
See, generally, everybody is scared to sit on a dental chair. We all have our visions of what happened. So I just would like you to focus a little bit on the surgery. I'm sure it's a surgery. So a little bit on the surgery, like, like how the procedure is done, how many sittings are required, and how you go about it basically.
Sir will be the best person to tell about the surgery. He's the pioneer. And then I will talk about how to fix the teeth.
You can add your points. Yeah.
So I thought you didn't want to see or talk about gory things.
For information.
Okay. Now, usually these procedures are done with what's called sedation, conscious sedation. This is a technique where a patient is given a sedative like diazepam or midazolam. So they are virtually sleeping in the chair. Or, so they're very relaxed, there's no anxiety, they're actually sleeping. And then we give the anesthetic injections in the mouth to numb the gum and do the procedure. So full mouth implants, patients really benefit with what's called sedation. Or you can do the whole procedure under a full general anesthesia, which is also in an operation theater as a daycare procedure. The patient comes in, we do the procedure under general anesthesia, which is little easier when patients have teeth. So to remove all the teeth and do a little bit of bone trimming and then put the implants and then sutures is much easier when you do it under a general anesthesia. Or a lot of times we do it with local anesthesia, which means injections in the mouth, but with sedation. So there's no anxiety from the patient point of view. However, when you're doing under sedation, you should have a qualified anesthetist with you. So the anesthetist can take care of the sedation part and you take care of the surgical part. So today sedation is becoming a huge opportunity for patients because, like you said, there are a lot of patients who are anxious. Forget implants, even for a filling, even for an injection. The word dental itself gives them, high blood pressure or anxiety and palpitation. So sedation is certainly a huge way forward, and many, many clinics practice sedation today. You want to add something, Sunil or Gauri?
Yeah, I would like to add, it's a very good area that when we are looking at a full mouth rehabilitation with conscious sedation, which we are talking. And nowadays, most of the, procedures, I'm sure, because I seen Prof. Gunshilan, who came down to Malaysia and performed this all-on-4 surgeries here. And in general anesthesia in the bigger setup of a government hospital here. And after that, this is actually more than 5-6 years. Now the new technology is artificial intelligence, which is taken place into a better and faster way of doing these Zygoma implants. I'm sure actually just now one of the slide it was showing that how they can prepare the surgical guide to place the Zygoma implants or any implants, full mouth implants, either upper jaw or lower jaw, without reflecting much flap. Patient doesn't have much problem, and it will be very fast. If I'm not mistaken, Prof, 20 years back, when you are doing the procedure, maybe little longer, and today with this artificial intelligence, I'm sure it would have cut down a lot of time, right? And immediately, because of this, artificial intelligence, and there is the teeth is already ready for the patient to fix. So when we do these implants, and within 15 minutes, the teeth are ready, right? With the, they printed and kept ready, and then they'll fix the teeth, and then patient can come out with a smile. This is called smile in the box. So we prepare everything in a dental chair, matter of 2.5 hours, they'll come out with the teeth, which is amazing. So those things was not there a decade back, and now things are getting much better and easy for the patient. So anything related to our teeth, to prepare that, Dr. Gauri, can you add on to that? So it comes under prosthetic area.
Yeah, sure. So once the surgery is over, then we start fixing the teeth on that. Like you mentioned, there are many different ways to do it. One is we take the measurement and we prepare the teeth and fix it. Again, that is matter of 2 days time. But now with the advent of digital dentistry, where everything is going digital, like how sir mentioned, we virtually do the surgery, we virtually place the teeth also. Basically, while we are doing planning for implants, we go from teeth to implants. So we always know where the teeth are going to be while we are planning for the implants. Now with the digital, with the 3D printing and everything, we can actually print and keep the teeth ready even before we start the surgery. So basically, when the patient goes in for a sedation or anesthesia, the implants will be placed and the teeth will be fixed, and they will be waking up to a full new set of teeth. That is the most advanced thing. Another way of doing it is after surgery, we take the measurement, we fabricate the teeth. Again, that is all digital now. Digital impressions and fabrication is digital. And then we fix it in about 2 to 3 days time. So by then the healing of surgery will be over. And like what used to be 1 year to 1.5 years procedure is now been made to 2 days procedure, literally 2 days procedure.
So no, basically what I wanted to understand is the whole timeline. From a patient comes to you and you prepare the patient and then you take him for the surgery, and then, does he need any kind of hospitalization? Because after this stage, the next thing that comes to mind is the cost factor. So we'll go into that. So I just wanted to understand this timeline, average, like how many sittings or hospitalization is required, or?
Sure. The pre-treatment timeline can be very, very unpredictable. For example, the patient's medical history is not great, the diabetes is not under good control, then we need to have, a couple of months' time to get that all sorted out. If the patient is a heavy smoker, we educate them, we try to wean them off or reduce the smoking. If they have a bruxing habit, clenching habit, we try to control that. So we do take some time for the pre-operative phase. And then for the fitness for surgery, for example, some patients may have, a low hemoglobin, anemic. So we need to correct that before surgery. So once that is done, and when we say, okay, we are going for the procedure, from the start to finish, its average is about 4 days. We remove the teeth, we put the implant, we take the measurements, we do the laboratory work, we do what's called a wax trial so the patients can see the appearance in wax. So they have an idea of how the teeth look. And to finish it, it's about 5 days. Right. That's the average time.
So the patient keeps coming and going, like it doesn't
coming and going.
Okay.
Yeah, if it's under sedation, if you do under general anesthesia, they stay in hospital for 1 day, like a day care, then they go home. Subsequently, every day they come for about an hour to hour and a half, and in 4 days, it's finished.
So now, what is the cost of this procedure?
There's a saying that, implants are not expensive. Mm-hmm. Not maintaining teeth is expensive. You don't maintain your God-given teeth, that gets expensive, all right? So implants, today, most of the implants are still imported. A lot of them are imported from Europe, a lot from Korea, Israel, and there's a huge entry tax for these implants. Only recently, we have had some good implants being made in India over the last few years. A couple of companies have started making indigenously. So I'll just give a ballpark figure for the whole arch. If you're doing the full jaw, one jaw procedure, including the artificial teeth, it can vary anywhere from 1.5 lakhs of rupees to about 5 lakhs of rupees. That's a huge range that we have. But now this depends on the type of implant, the number of implants, the type of materials that you use for your artificial teeth, and whether you need to put some artificial synthetic bone during the procedure. So a lot of factors go in. That's why we have such a wide range. The usual is about, I don't think you can do any reasonably good quality work at less than 1.5 lakhs rupees. And then you go up to 5 lakhs. These are all standard sort of procedures. And then when you want to have much better materials like a titanium framework or ceramic teeth, we have acrylic teeth, we have teeth made of PEEK material, we have ceramic teeth. So all this will influence the cost of treatment subsequently.
Right. No, because like you said that you are the pioneers in this discipline. So there would be perhaps other centers also offering this kind of facility. So how does a patient choose the best center? How for a lay person?
Okay, Sunil, how do you?
It's actually the layman to choose who is a good implantologist. That's your question, right? Straight question.
Yeah.
Actually, see, nowadays, everybody, majority of them are well educated. Everybody got a very good friend called Google. So, yeah, it's true because everybody see whatever doctor tells today, but before that itself, they Google it, they'll read, and then they'll go there. When they are going through there, and they should have to understand. Yes, Google is giving information without doubt, but at the same time, so doctors who are performing and they have some kind of credentials will be there, like Prof. Gunashilan, that when he's done the cases and which are not that easy cases, and the publications, so which is there in the internet itself, it is available. Yes, so and so doctor is done these many cases, and this is a success, and these are the cases which is not done by anybody else. I am pretty sure that such cases, what Prof did is nobody done in India. Okay, there are a lot of people coming from even from outside, without doubt. So like that, I mean, patients has to go through some kind of a research about the center, a doctor who is performing. Obviously, this is most of the maxillofacial surgeons area, that is Zygoma implants, and who are pretty good. I mean, I'm not telling that other departments they are not able to do it, but for them it will better, easy for them compared to, because they train in big surgeries compare to, you see, I'm a periodontist. I'm not trained in a very big surgeries like a Zygoma area, which is next to the cheek and then near to the eye, and without a good training I cannot just play around it. So maxillofacial surgeons are better ones who can do good I mean, like Zygoma implants. Conventional implants, as I said, that they need to check a bit about the center and how they are doing, and some kind of a knowledge the patient should have, because I believe educating the patient. When patient comes to me, that we educate patient should know everything, and give some time to understand, and then ask patient to come back, and if they have any more questions, we explain thoroughly, and then we go ahead with the procedure. And I just want to add one point about the cost when you are talking that actually India is pretty cheap. A lot of patients want to travel to India. Because of pandemic, there is a break. Otherwise, there's a big number of patients. Full mouth rehabilitation, upper arch and lower arch with the teeth. I want to do here, I'm doing also. So which not less than 25 lakhs in Indian rupees. So which is a very, very big amount outside India.
Almost
So
lifetime.
yeah,
Yeah, right. Okay. So since we're discussing cost, we already have two questions. And sir, you in your slide presentation said that there are a lot of below 50 or a lot of younger patients you're getting. But I have these two questions from very senior citizens. So, I mean, whoever wishes to take the question, one person is asking Mr. R. Sundaraman, what will be the treatment period and exact cost of treatment for Zygoma implant for a patient of 80 years? Does the treatment cost vary with age, or the treatment plan vary with age?
Okay. Age is not a deterrent. Health is a deterrent. So if you're in good health, and for example, if you're diabetic and it's under good control, if you have blood pressure and that's under good control, then age is not a deterrent. Our oldest implant patient is 85 years old. And he's already 6 years post-follow-up. So he's 91 today. So age is not a criteria at all. So if your health is good, you can certainly have implants. And the cost is what I said like earlier. The Zygoma implant for a job will be easily 3 lakhs to 5 lakhs. That will be the range, depending whether you do 2 Zygoma or 4 Zygoma implants and the materials that we use. that would be the sort of rough range in India. So Sunil has already said his rates in Malaysia.
So you said your oldest patient is 85 years old. I'm giving you a 95 years old now.
I want to add one point here. I want to add one point. See,
Yeah.
I did a patient 7 years back, 91 years old, female patient, 91.
Oh.
So as Prof told, there is only medical conditions which we need to consider. Other than that, age is not a very big criteria. What I mean to say is there is a criteria, but not the 100% criteria that, okay, you are 90 plus, so I don't want to treat you. Not like that. If medical conditions are good enough, that we can treat. Mine is a female patient, 91 years old, full mouth implants I placed.
Wow. So here we have 95 years old Dr. Ramaiah, who himself is a medical doctor. He's saying, I have lower implant perfect and upper since the jawbone is narrow. So I've been told that it is not possible for implant. So do you think you would like to undertake to do upper implant in his case? He's asking. I am prepared to report to you with my implants and how much budget.
I think it'll be a pleasure to treat a fellow medical professional, and an honor actually. And I'm really impressed at his what shall I say, enthusiasm. At 95, if he wants to have a good set of teeth, to have a good smile and a good life, we are very happy to help them. And like we also said, health is the main criteria. If your health is good enough that you can withstand sedation, we are very happy to help you. Don't worry about the cost.
Thank you. Dr. Gauri, let me bring you in. If you could tell us a little bit about, the rate of failure of such procedures.
Zygomatic implants are very, very predictable because the zygoma cheekbone are one of the hardest bone. So when we put implants, they integrate really, really well. Failure rate, what we have been recorded and worldwide recorded, is 2%. And that is majorly because of infection, what Dr. Gunaseelan and Dr. Sunil already mentioned, because when they don't maintain their teeth, they lose their teeth. So similar way, when they don't maintain the implants, they get infection. Medical conditions like diabetes, smoking, all that will influence the longevity of implants. So to prevent infection, all that has to be under control. So with that, 97 to 98% success rate is easily predictable with zygomatic implants. And to add to another point of what we were discussing before, when you say in old age, when we want to give implants to those patients, medical conditions like when they have removable dentures, when it is not implants, what is the other option? People wear removable denture, which they have to remove during nighttime and put it during the daytime. The major concern that a lot of old age people that we see is that they're not able to chew food well. When they don't chew food well, digestion becomes an issue and they end up in a lot of gastric disturbances. So it is not that when you get old, teeth are going to go and you just have to wear a denture and bear with that. That is a common thought that is going around people, which is very, very wrong. For your general health, you need a good set of teeth. And these zygomatic implants, over which we give a metal framework, it could be titanium, it could be cobalt chrome, it is a strong base that we give on the implants, over which we give fixed teeth. So they're just like your natural teeth. They don't move, they don't impede your speech, they don't impede your eating and everything. So as you age, you need a healthy set of teeth to have a good general health. So that is another point that I want to highlight that people have to have in their mind.
Right, because again, another Dr. Suresh Kumar Mishra is asking a similar question, that what is the success rate in dental implants, and if it deteriorates with advancement of age, and also anything to do with gender specificity.
No, we do regular follow-up. They have to come for regular maintenance. And if there are any early signs of infection, or if we know that there is going to be a problem, we catch it very early and we treat it, and the results are very, very predictable. And the complications would be surgical complications and teeth complications. teeth complications are very superficial. There are so many advancements to fix it instantly. And surgical complications, I'd let Dr. Gunasilan tell you that they are also very manageable, but it requires a lot of expertise though.
Dr. Sunil, could we focus a little bit on the post-operative care? As you know, you have mentioned briefly, how important it is to take care of the teeth. But could you just break it down and tell people, what exactly they should be doing after they undergo this procedure?
Okay, actually, everybody has to understand. Implants are it is mimicking the natural tooth, right? So, how we have to maintain our natural teeth, and same way we have to maintain our implants also. And after the treatment, we have done the full mouth rehab. I mean, like we are given a Zygoma implants and a couple of other implants, and then upper and lower arch is replaced with the implants. So patient, food, it will go and stay in certain areas, a small debris. So which if they ignore, if they are not maintaining that area, it's like every day you need to brush because it's fixed, right? So it is not removable. You need to brush every day. You need to maintain, and you need to floss. Floss in the sense nowadays there is a water floss, one of the most efficient than using the hand thread. Hand thread we call that is a regular floss. We are using from quite a long time. Now recently, maybe 5-6 years. A lot of people are able to understand the water floss. Now it is a just water pipe kind of a thing. If you press the button and then water will go a little faster and then take out the debris. If you won't remove the debris, and that debris can cause getting some bacteria inside, those bacteria are going and eating your gum, and then gum is supporting around the implant. So below the gum, bone will be there. Implant is properly held by the bone. So gum get infect first, and then from gum it goes to the bone. And if bone get infect, and then automatically the bone will hold the implant, right? So it says that I can't bear this because I don't have energy. So it leaves. And then implant is start mobile, and then entire framework, whatever the hard work which is done by the doctor and the patient took so much of pain for that, and financially. So it's all go into the drain. For that reason, we say that, and especially full mouth rehabs, please visit at least every 4 months to 6 months, or even 3 months also. It's very nice to come back to dentist, and it's hardly 10-15 minutes. Everybody say that, time is most important, right? So I'm very busy, I'm not able to come. But you need to spend a little time for your teeth. Otherwise, the function, most importantly, we look at teeth means function, and without doubt, aesthetics will come in. So if any dentist, if they are looking at, if patient comes and asks, yes, I need function, means without fail, they say, yeah, I'll give you the aesthetic also, because it comes together. It cannot be separated. So in that case, patient mandatory keep themselves for maybe 15 minutes or take a prior appointment and go to the same doctor. You'll see that these areas you are not maintaining well. It is very initial stage. I'll remove, and only doctor can remove those framework. Patient cannot remove at home. So they'll remove, they clean it nicely and then put it back. If needed, they will explain how to maintain, or any medication is needed. Very initial stages of any disease can be corrected fast. If it is late stage, if they come, we can't do anything. So entire bone and gum is gone. So there is no found base, right? So there is no base to hold that. When we construct the house, a pillar is not strong. How good you construct your house? There is no point. The same way this is also. This is only intraoral engineering. What I'm trying to explain, that they have to maintain well.
So what I was about to ask you, the same point, like whether this total mouth implant is more for decay or more for aesthetics?
More for
decaying or
okay.
No, each person will have a different priority when it comes to teeth replacement. Some people would want teeth just to chew and eat. Now we all have follow a different diet regime, and then we all have food modification, diet modification. So there'll be one group of people who just want a good set of teeth to chew and eat well. There'll be another set of people whose main concern would be, just to have a beautiful set of teeth and smile and all. Another set of people who would like to just have a stable teeth and socialize well, smile and socialize. All these while they would have had crooked teeth and very embarrassing, not socializing. So they just want to have a nice set of teeth. So priorities differ, and we cater the treatment and set of teeth according to their priorities. But everybody would require a stable and good set of teeth for their well-being, physical and mental, I would say.
Right. So the other point which has been highlighted is, when I'm spending so much money, and of course, doctors are emphasizing on maintenance, but what is the average shelf life of an implanted tooth or teeth? Can we say anything like that? Like, how long does it last? Is there any kind of permanency?
When we talk of this 98% success rates, the time frame we are looking at is actually a person's lifetime. The implants that we have got documentation of are all over 50 years of use in the human body. More than 50 years of longevity has already been documented. And these are these well-established companies which have this data, and they're published in peer-reviewed journals. So we know that this is all a fact. And we are also seeing the long-term effects of these titanium implants because they are biocompatible. The biocompatibility is proven beyond doubt. And newer materials, newer surfaces come to hasten the treatment. But otherwise, the longevity is really, if your health and your bone metabolism is good, they can live, they can last as long as we live. In general, if you want to say, 50 to 60 years is the lifespan of these implants.
All right. Okay. Now, actually, there are a lot of personal questions. I won't take all, but quickly I'll run through a few. Whoever wants, you can pick it up. So one person is saying that my HbA1c currently is 7.6. Is it possible to go for one tooth implant front lower where there is some receding bone structure?
Sunil, you want to take that?
No, absolutely. Patient, yes, sir. Yes, the patient 7.1 is easily they can go ahead with the implant placement, and if eventually this is a alveolar bone we call what is there inside the mouth. If patient wait quite a long period, maybe 3 years, 4 years, 5 years, then I want to get implant, means there may be chance that the bone would have gone from there. If there is no function to the alveolar bone, there is a high chances for disappear from there and will go and adopt in some other area. So if he is really looking at implant, he has to see the implantologist as early as possible. And 7.1 is not a, big, it's a borderline. So if he's able to maintain well with the same figures, and there shouldn't be any problem for him.
Can a patient with sinusitis undergo Zygoma implant?
Good question. Actually, if they have acute sinusitis or recurrent sinusitis, you have to be careful about Zygoma implant because we're very close to the sinus. So we have to adapt the technique to what's called an extra sinus surgical technique. We have some techniques where we completely avoid the sinus. We don't go inside the sinus at all. Whereas in some techniques, you go through the sinus. So if the patient has chronic sinusitis, it's not a contraindication. We can still do the Zygoma implants, conventional techniques. Whereas if the patient has, say, allergic sinusitis and frequently recurring acute sinusitis, then you have to modify the technique and look at a technique where you place the implant outside the sinus rather than going through the sinus. So we have to be careful about the surgical technique in that instance. So it's not what we call as an absolute contraindication. It's a relative contraindication, which has to be assessed on a patient-to-patient basis.
Mr. A. Sekar wants to know for a patient above 70 years who has undergone heart procedure. So is it advisable for him, and does he require cardiologist clearance?
Briefly, again, depending on what procedure, whether he's had a bypass graft or a valve replacement or he's had a pacemaker, or whether he's had angio. Each one will vary our approach. Usually, these patients are also put on usually blood thinners. There are several categories of blood thinners. So based on that, we will advise the patient and give them in writing actually. And we definitely would get the clearance from the cardiologist, because some protocols are changing. For example, nowadays, when a patient is on a routine small dose blood thinner, earlier days they used to stop it and then come to us for any surgery or extraction or implants. Today, the American College of Physicians and most of the international cardiology bodies have said you can continue to take the blood thinners and still do a minor, dental procedure, because you don't want to stop a blood thinner and then even for 2-3 days they have cardiac protection is lost, and they may have a cardiac episode like a blood clot, which is very dangerous. So we don't actually stop any of the routine blood thinners for implantology today. Even for full mouth implants, we don't stop the blood thinners. But we give a note to the cardiologist and they're also aware of it. Whereas if they've had like a prosthetic heart valve or valve transplant, then we have to cover them with some antibiotics. A prophylactic antibiotics like 3 grams of amoxicillin 1 hour before the procedure. There are some regimens for that. So if he gets back to us with what exact cardiac issue, we can accordingly advise them.
Can it be done in case of osteopenia?
Okay, Sunil, osteopenia.
Actually, we need to assess the bone quality. Before we are going into osteopenia, osteoporosis. These kind of cases, we will come to know after doing. There is a scan which we will do it, and then we'll find out what quality of the bone which is available in the patient. After that, definitely we will check the values of the bone density, and then if it is a better quality of the bone, 100% we can go ahead with the placing of implants.
What about menopausal women, Dr. Gauri, and who have calcium deficiency? Would you throw some light on that?
Yes, basically the bone quality and quantity are important when we plan for dental implants. Quantity, we do a CBCT, a cone beam CT scan, to evaluate the amount of bone, which is the quantity of bone that is available for that particular person. When it comes to quality of bone, there are various things that might impede the quality of bone. Like you said, postmenopausal women who will have a condition called osteoporosis, where your bone becomes very weak. In those kind of patients, we do a DEXA scan. And those values will tell us if the bone is healthy enough for us to plan implants. Many cases, we have diagnosed osteoporosis while we routinely check for dental implants, which they weren't even aware of before. Because it is more important for the general health, for the spine, for the hip, for the neck, and everything, where you have to maintain a healthy bone. So likewise, it is very important to have a healthy bone to hold the implants on a long term. So yes, people who are more prone, who have a familial history or who have already been diagnosed with osteoporosis, we make them do the DEXA scan, see the values, and depending on that, we evaluate the patient and plan for the implants. And we do more frequent follow-up on them just to make sure that it is all maintained well and all those. Again, it is a patient-to-patient basis treatment planning criteria.
Dr. Sunil, Mr. Jaganesan wants to know, is Zygoma implant the best procedure available as on date? And as you mentioned that, it costs much less in India compared to the West. So are the skills of our doctors here also number one, or is it because of the cost that people are coming to India?
No. So very honest with you, the skills are amazing for our maxillofacial surgeons and implantologists in India. That is the first thing I really want to stress on that, without doubt, because our exposure is much better. And there are good training institutes like Rajan Institute. Since I work for an organization called ICY, which is a non-profit organization in implantology. So we identify certain centers that they really teach well. So, and the skills, what they learn there is inpatient. But outside India, there are very certain countries, very limited countries exposure with the patient. That if you see that India is the best, without any doubt, I can say that. And second thing is the best treatment is Zygoma or not. Okay. See, Zygoma implant, we are going for the patient who doesn't have bone. He doesn't have any upper jaw bone is there on the backside where we cannot place any conventional implant. If there is a bone, if we go for a conventional implant, so obviously we tell the patient prefer conventional implant, go ahead. Where you don't have an option, see, everybody say that no, there is no option to place conventional implant, you don't have any bone. The best method is at present with the proper systematic reviews which is available and lot of evidence is there, Zygoma is the best.
Dr. Gunasilan, some of our members of the audience want to know that whether this facility is available in the government sector as well, and being a expensive treatment for many. I mean, some have expressed that it is kind of a luxury treatment, perhaps. So does it come under the ambit of medical insurance, or how could doctors help?
Unfortunately, most of dental implant treatment is out of the ambit of insurance. Not just here, even outside India, insurance does not cover for implant work. Having said that, we have trained over the last 10 years many maxillofacial surgeons and prosthodontists and periodontist teams from all over India, including the government sector. A lot of them have been trained by us and they've gone back to the respective institutions, including government institutions, and they've started doing this work. But certainly in the government institution, the cost may definitely be lesser because of the infrastructure costs are less. But the material and the implants are still imported. We do not have a single Zygoma implant made in India as of now. All the Zygoma implants are still imported from Europe or from Israel as of now. So that's why the costs are still on the higher side. And in the government, there could be relatively less expensive, but it can't be, I don't think it can be brought much lower down because it's in the government sector. And a lot of government sector hospitals in different states do it because it's only that you need the training. Once the doctor and the team, the teamwork is also very important. Let me emphasize that it's not just a one-off surgery that, heroic surgery, you do it and then fit and forget. It cannot be like that. It's a teamwork. It's a lot of planning. And your follow-up is very, very important to identify problems or issues early. Because if you don't identify problems early, then it can become a catastrophe. So, but the advantage of Zygoma implants is worldwide, people are reporting anywhere from 97 to 100% success rates. There are several studies reporting 100% success rate, which is phenomenal for implant industry. We don't usually see more than 95 to 98 average in single implants, and 95 and above 98 and all is phenomenal success rates. So that's one advantage of Zygoma implant. It is not so technique sensitive. It is not so operator sensitive. It's a good technique. And as long as you do it properly, it can give you very good results.
Like you mentioned about post-operative care and taking care of our infections and other ailments. So somebody wants to know, does the enamel on the teeth also wear off with these implants?
We have different materials that we use to give the teeth. Like Sir mentioned already, we give acrylic teeth, which is another plastic kind of material. There is PEEK, which is polyether ketone, again, a little lighter material. There are ceramic teeth, which are a little harder than that. Recently, there is another material that is of much importance, which is zirconia. So we give teeth in zirconia also. And these teeth are very, very hard and they look very similar to the natural teeth. There will be wear and tear with these teeth, like how we have in natural teeth also. There are ways to manage it, which fixes it instantly, but there is no enamel on that teeth. The materials differ. but there is usually no breakage or, like teeth falling off or anything of that sort. But you can expect wear and tear because patient is wearing that constantly through the day, biting through it, speaking, eating, chewing, everything. And we give what is called a mouth guard for those patients who get full mouth implants done, because to avoid unnecessary forces that are directed towards the teeth and implants. Even with that, we can expect minor wear and tear, which can be periodically, checked and modified.
So even though we have to take care of our diet and lifestyle choices, if we have, so many other multiple ailments, but suppose somebody is totally normal and goes for a total mouth implant. So do they have to take care of any specific nutrition or intake or anything like that?
Sunil, can you take that, please?
Yeah. Actually, this question is a very straightforward. The thing is that the implants, if patient who is really healthy, everything is normal, and we place the implants, diet aspect, there is nothing to take care of anything. But only thing is maintenance. Because the person who is coming to a dentist, whatever age, I'm not talking about elderly patients, and then if they are in 30s, 40s and all, the maintenance is a problem. So if they're able to maintain well, I don't think so they need any more specific diet and all those things. Good thing is they need to maintain well, and they should see the dentist every 3 months, which helps them to understand whether they are doing well or not.
One last question, basic question. How painful is it for the person who sits on the chair or goes to the operation theater? Everybody has this fear. Somebody even takes that flower therapy to kill anxiety before they go to a dentist. So they want to know how painful is it?
Okay. The pain normally sets in day 2. Once you're out of this anesthetic procedure and all that, certainly you have pain. You also have a little bit of swelling. So we give medications as 2 sets, one for the pain and swelling together. And we also give a little extra painkiller for escape medication. Each patient's pain tolerance is very variable from patient to patient. So there are patients who have not taken any painkiller in some of my full. They just said, we just took one and then we didn't take any more after. And then there are others who need level 1 painkillers and level 2 painkillers, and sometimes even level 3 painkillers. So that's very individualistic, and which is also needed only for a maximum of 4 to 5 days, not more than that. By the time the body has reconciled to the whole process, and you don't need any more of those painkillers. So 4 to 5 days. But certainly the anxiety is something completely different, pre-op anxiety. So a lot of patients, especially in the US, are given pre-op sedation, oral sedation. They ask them to take a diazepam tablet, 5 milligrams or 10 milligrams, 1 hour before coming for the dental appointment. Only thing, they cannot drive on their own then. They have to bring somebody else as an attendant. So they take this oral sedation by mouth tablet. That's really helpful for them to reduce anxiety. But from the surgical point of view, that is very unpredictable. When you take by mouth, the sedation can have extremely variable results based on the age. So we prefer to have that under our control. So the anesthetist gives intravenous sedation. So you get an IV line ready, and they give the injection. They monitor the patient continuously, and they give the intravenous, which is very controllable and very predictable. 30 seconds, patient is asleep. He's snoring actually on the chair. And then you give your anesthetic injection. They don't feel anything. You can give even up to 7 or 8 injections, what we normally give inside the mouth for full mouth implants. You finish the procedure in a couple of hours. You wake them up and send them home. They have no recollection of what we did. That's called anterograde amnesia. They also have some amnesia for that during that period. So it's really, this sedation, conscious sedation, is a great boon for anxious patients and for patients who need little extended treatment.
Actually, I want to add, sorry, I just want to add one point here. Actually, yes, a lot of patients will come. First question is there any pain? So my standard answer to them is, pain, you leave it to me, I'll take your pain, but there will be little swelling. So it is actually, if you ask me for a single implant or anything, it is hardly 8 minutes procedure. And even extraction is a bit painful than placing implant. So any patient should not worry about the pain. So they'll have a little swelling. But if it a bigger procedures, what we are going to like Zygoma implants and full arch cases and all, as Prof said, so they have to undergo all those things which may be a bit comfortable to them. Otherwise, the pain may not be a consideration for dental implantology, as per my experience and practice.
Slightly repetitive, but sorry.
A tooth removal or a root canal treatment that they get done, that is the amount of discomfort that they can expect while getting an implant treatment. And it is nothing different or nothing more that they can expect out of it.
Right. Again, little repetitive, but a quick wrap up, whether people can continue to smoke, whether people can continue to drink after they, I mean, whatever hobbies or people have, whether they can continue after they undergo this total implant.
So for smoking, I can take, but I 100% say that smoking cannot be. That area is no. So better to stop. It's not only for dental implants; it's for entire body.
And again, there are a lot of questions people are requesting for how can the doctor community help us on the insurance aspect.
See, one of the things we have done with the government now is we have written as an organization. We have, professional societies. We have the Association of Oral and Maxillofacial Surgeons of India, and we have a state chapter. So some state chapters are written to the government, especially after COVID and patients having the black fungus, the mucormycosis. In this situation, they lose the upper jaw bone and teeth because of the fungus. And this has happened to a lot of youngsters now. So we have done several patients where they have not just teeth are gone in the upper jaw, but also the parts of the jaw bone, maxillary jaw bone, upper jaw bone. So we have done 4 Zygoma implants on such patients and give them a restoration. So this becomes a completely different set of things. Like after trauma, accidents, after a tumor, some people have some cancers in the upper jaw. We remove the jawbone. And then mucor. These are very, very valid situations for reimbursement by the insurance. So we are given this as a request to the state government, or most of the state governments have got a request from our associations as the professional bodies. So now we'll have to see how the insurance companies and the government respond. Yeah, we have made a formal request already.
Right. So thank you, sir. We have been given the indication to wrap up this discussion. And I would really like to thank all of you for sparing so much time and sharing so much information. And a special thanks to our sponsors, Rajan Dental Institute, for bringing this series edition on the Hindu Wellness series. I also thank all the participants for helping to make the discussion lively with their questions. And I'm sure they have got a lot of takeaways, but due to time, we couldn't accommodate all. But there are a lot of, as I said, a lot of questions with their specific reports, which maybe we could forward them to you and you could directly answer them through your emails. So thank you all once again. And I hope we can all continue to spread joy with a beautiful smile always. Thank you so much.
Thank you.
Thank you.
Thank you.
Bye-bye. Parvala.
Post stop your video.